Welcome to the 2011 Health Sector Bargaining Conference.
Hi, I'm Guy Smith, your president. This is the first day of a two-day bargaining conference where we brought bargaining teams representing thousands of healthcare workers across the province to discuss upcoming and ongoing rounds of negotiations with Alberta Health Services and other employers in terms of what we can do to get good collective agreements for our members that help them continue to do the fine work they do for Albertans every single day.
The conference will pose an opportunity for you to discuss your issues, to share your points of view, to talk about bargaining strategies, and to set priorities for bargaining. This is your conference, and it will only work with your input.
We got declassified. So what tools did you use to declassify us? And if you have no job description, they told us it was a work in progress. They have nothing to give us.
I would like to know how many people in this room make more than 20 bucks an hour. I make 19.
Economic research of a certain kind forms part of the foundation for collective bargaining, and the reason that it does is that collective bargaining is fundamentally an economic activity. It is what determines the price the employer pays to purchase your labor power. So by trying to identify and keep on top of what's happening in the economy, we can hopefully identify opportunities, identify chances to exert leverage in bargaining, and identify threats and areas that we have weakness and we have to shore up.
We've heard what the economic outlook looks like. We've heard about the struggles that other bargaining units are having right now and how we have to pull together as a union to support each other, because potentially in the next few months we're going to have a large majority of our members all in negotiations at the same time.
But the most important reality I think that we have to recognize, and not just recognize but use to our advantage, is that we as a union can achieve anything we want to if we put our minds to it, to protect the rights of our members in their bargaining, but also to stand up for Albertans and to protect their healthcare systems that they rely upon. Now, you are the leaders in making sure that that reality is realized, and it's our responsibility to translate the things that our members need in terms of a good collective agreement. And the key message to our members and to the government and to other employers is that we are not afraid of the fight, because we know it's going to be a fight. And we can't be afraid of the fight. And we have to stand proud, we have to stand together, and the government, other employers, and the public, and especially our members, need to know that we will do whatever is necessary to make sure that we get good collective agreements so they can do their work and do the best work possible on behalf of the people of Alberta who rely on you and your colleagues every single day. So let's leave here with that message, to be strong and determined and get good collective agreements. Thanks very much.